Hi, my name is Mike Solowski. I'm a kinesiologist and corrective exercise specialist with the Norwest Co-op Community Health Center's Hands Kai project. We're here today in Winnipeg, Manitoba, Canada. We're going to be discussing bodyweight exercises, resistance band exercises, and mobility exercises. Now, before we start anything, please consult your primary provider if you have any concerns about why you shouldn't be doing any sort of exercises. These can range from things like uncontrolled diabetes, hypertension, or heart conditions. While you're doing any of the exercises, if you notice any abnormal pain, stop doing the exercises. That said, also with chest pain, jaw, neck, throat, or arm pain, discontinue any exercise and see your primary provider. While you're doing any exercises, if you notice that you have a shortness of breath, unusual tiredness, dizziness, lightheadedness, joint or abnormal muscle discomfort, discontinue exercise and see your primary provider. This is flexibility and mobility. Many of the exercises I'm going to show you can be done for either or. Basically, if you want to use these for flexibility, you can hold the posture for up to 30 seconds. To use it as mobility or as part of your warm-up, just use the motion in a fluid motion. For instance, just a slow twist back and forth instead of holding a twist for over 30 seconds. The shoulder dislocate exercise. For this one, you can use a resistance band, a dowel rod, or a broomstick handle. The resistance band is the easiest for somebody with limited mobility in their shoulders. Keep your arms extended straight out in front of you, raise up, and as you progress over your shoulders, try not to allow your lower back to hyperextend. Basically, what you should be doing is aiming to touch the band to your butt. Turn back. All motion taking place at the shoulder. From a different angle. Keep your posture upright. And extend your shoulders over. The one-arm chest stretch. The chest muscles easily become contracted and often roll people's shoulders forward. This can often cause muscle tension headaches and muscle tension buildup in the upper back and neck area. For this, use the wall, extend an arm out, place your arm and shoulder directly against the wall, and gently turn your body away. You should start to feel it stretch across the front of your shoulder, across your chest. Hold the posture for a few moments and release. The lats can easily influence your shoulders. When these are too tight, you can often feel pain right at the shoulder joint. For this, use a low-level table or chair. Place your hand and imagine that it's stuck to the back of the chair. Separate your feet, lean your body weight backwards, and imagine that you're pulling your body away from your hand. You should feel the stretch all along that big piece of muscle connected from your back to your shoulder. Hold for a few seconds and relax. The T-spine twist. So all mobility, when it comes to twisting, should be happening at the very top portion of your upper back. For this exercise, stick your hands straight out in front of you, bend slightly at your knees, keep your hips locked and your belly button pointed forward at all times. You should not be twisting with the lower back. So for this, imagine sliding your shoulder blades along the back of your ribs, side to side. If you were to do this as a stretch, you can twist and hold. As a warm-up, just moving back and forth will help your body loosen the upper back. Again, note my hips are not moving side to side and my belly button is pointed straight forward the entire time. Hip flexors are notoriously bad for becoming very over tight. For this exercise, you need to step forward, keeping your hips upright and locked forward, and just slightly push your hips forward. You should feel a pull in the front of the back leg. Hold for a moment, and do the same to the other leg. I'll show you this again on the side. So again, step forward, push the hips forward, keeping your posture upright. Again, you should feel a pull in the front of the back leg. The hamstring stretch. Resist the urge to bend your lower back. At all times, keep your upper back completely straight. Extend one leg out, the other back leg slightly bent. And just gently slide forward. You should feel the pull all in the back of the leg. Hold for a few seconds and return back to start. The quad stretch. Simply enough, if you need extra support for balance, use the back of a chair or a low table. Stand on one foot, grabbing your ankle and bending your knee. Keep the knees together and gently pull the ankle towards your butt. You should feel the pull at the front of the leg. From a different angle, stand on one foot, knees together, gently pulling the ankle up towards your butt. Groin or inner thigh stretch. For this, extend one leg out to the side and shift your weight onto a bent knee. Don't let the knee go over the toes and just hold the stretch. You should feel this in the extended leg. And return back to start. The calves have a huge influence on your knee health. For this exercise, use a wall. Place your toes up as high up on the wall as you possibly can until you start to feel a stretch in your calves. Hold that position there. And if you notice that your flexibility is all right, you can slowly bring your hips towards the wall. This will increase the pressure on the calves. Hold for a few seconds and relax.